So doctor, we've seen each other, we've done a consultation, we've examined everything, we did the test that we recommended, we did the heartburn test, and I definitely have reflux. So now what do I do? How do I get treated? The most common treatment in America today, in the world today, is using medications. This is the way we treat heartburn today. So there are things that are very quick acting and short lasting, okay? These are the quick antacid reducers, like things over the counter, like you get Tums, or you can get Maalox, and milk and magnesia. This is the thing you keep in your purse or your back pocket. You're having dinner somewhere and you always get a little bit of reflux, and then you know that you try a piece of that lemon meringue pie, and then you just throw in a Tums, and then it takes care of it, and you don't have to have all that bloating, and then it can be kind of embarrassing. That's one way to treat. That's quick. Other things are what's called H2 blockers. These are the drugs that go by the name of Pepcid, famotidine, or Zantac, and as you guys know, that one has been recalled and is not in the market anymore. And then we go to the big guns. So the big guns are the class of drugs they fall into is PPIs. PPIs, they stand for proton pump inhibitors. And these are very, very strong drugs. You're blocking the acid pump in the stomach. And there's so many different names out there. Every day there's a new one that comes out. And the common ones are Prilosec and Pantoprazole and Acifex and Nexium, and the list goes on and on. They're all different names, different companies, but they're the same drug. But this is medical therapy. And I want to remind you that medical therapy, you're treating the symptoms. You're not treating the problem, which is okay. And this is going to be a discussion between doctor and patient. It comes down to, are you okay with taking medications? Now, the medications you take, I want to remind you, they work. I just like you to be aware that those medications are not free of side effects. If you look online or inside the medicine things, you should actually have side effects associated, and there's a whole list of side effects. It's still safe, but it has side effects, and you should be aware of those side effects. So you know that I'm taking this pill every single day, not for a month, you're gonna take it for years, and I'm gonna take these medications, and what are the side effects? What are the downsides of taking these medications? So, and then it comes down to you and your physician talking about, number one, I'm 30 years old, I'm 40 years old, I'm 50, and I'm gonna be on these meds for life, and that's a decision you have to make with your physician that you trust, and say, I'm on these medications, do I wanna continue these medications for life, and what are the other options?